Today we're going to do a sterile moist dressing, and we're going to do this a little different than our other sterile dressing where you will be having a sterile field, and we'll set the drape up. So we will make sure we have gathered all our supplies. I have my water and my lipping device. I got my hand sanitizer in addition to my supplies. What I need to do first is take off my old dressing and measure it. So I've got a measuring device here that has circumference and centimeters, and I've got a blue pad. So I'm going to set that up right beside my patient with my measuring device that has centimeters and inches and a diameter. So I'm going to set that right there. I'm going to put some cotton tip applicators also right beside it because I'm going to measure the tunneling and the undermining. So now I need some clean gloves to take off that old dressing. I need to wash my hands before I put on my clean gloves though. Washed hands. All right. Okay. So I'm going to take off my old dressing and my packing. Now I'm going to look at my dressing. I'm going to examine it for color, odor, and consistency. There's no drainage right now. And then I'm going to look at the wound and see if there's any erythema, edema, or exudate coming out of the wound. And there's not at this moment, so I'm going to throw that away. Now I'm going to get my measuring device and I'm going to put it over the wound. And it looks to be about 5 centimeters. About 5 centimeters according to this little device. Now I'm going to take my cotton tip applicator, and I've got some tunneling right here. I'm going to put the tip all the way until I feel a little resistance, and then I run my finger and forethumb to where it meets the skin, and then I'll measure. I'm going to put this right here so you can see what I'm measuring. I'm going to measure how far that is. That's about 2 centimeters. And then I'm going to measure the undermining. And that's about 1.5 centimeters. I'm going to check to make sure I don't have any other undermining. And I don't. Okay, so I'm going to leave that there. And I'll set up my sterile field. Take off my gloves, sanitize my hands again. All right, and before I get all of my sterile, I'm going to make sure I have everything that I need. All right, I've got some sterile cotton tip applicators. I've got a combine pad, otherwise known as an ABD. I have a pack of 4x4s in the little plastic container. I have my sterile gloves and I have my sterile drape. I've got my solution and my lipping device. So to open your sterile drape, just like you do with any of your other packaging, make sure you do not go past the blue border. And then you reach in and there's a little corner there, and I open mine up and lay it down. Okay? And then I'm going to open my 4x4s and dump onto my sterile field. And then I'm going to set it right here beside my solution. When I'm opening and dumping onto my sterile field, I don't open over it. I open beside it and dump. You see I've got my table at my height. I'm going to check my solution for the correct solution, and it's been open before. Make sure it's not been open more than 24 hours. Keep my lid down, lip it, pour a little bit into my vessel there, and then I can move this to the back. Give myself some room. Now I need to put on my sterile gloves and get down to business. Alright, I'm gonna take half of my 4x4s and I'm gonna put it over in my solution there. I'm gonna take one of my Q-tips and make sure it gets good and moist. Then I'm gonna reach in with one of those and make sure I get a good one that's nice and moist, because we need it to be damp but not squishy. Then I'm gonna unravel it and I'm gonna twist it over my Q-tip. I'll try to twist it over my Q-tip. And then I'm going to pack it into my wound gently. Trying not to contaminate myself. Packing your wound, make sure that you don't have any gauze over the edges so that the wound does not macerate. And then I'm going to apply some dry 4x4s and my ABD pad to the wound. Tight, and then I'm going to clean up my area. Take off my gloves without contaminating myself. Wash my hands and I'm done.